give it up happily because it's one of those things which I don't enjoy doing, but somebody has to do it. Um, yeah. Right. So the objective is to talk to you about augmented reality and its role in liver surgery. I'm going to talk to you about where we are at the moment, where we are headed, and what do we aim to achieve with all this. What I'm not going to talk about is how to do a liver resection, because that's not the remit of this talk. I'm not going to talk about the indications of liver surgery, comparison of open with MIS and all those things. So we're going to talk purely about augmented reality. The reason we're talking about that is because we live in the information age. This is the new age. This is where the future lies. And I think for the young ones here, for the medical students who are coming out, this is important for you guys to understand and know about, because this is going to be probably everywhere by the time you start getting to your 40s. 70% of the world does not have access to basic surgical practices. So a lot of you are going to raise questions on why are we looking at all these things when 70% of the world doesn't have access to good quality healthcare. The answer to that is in Pakistan, we're not probably not in the 70%, we're a bit less than that. But those who can afford good quality healthcare, those who can afford to do these complex surgeries, this is going to be part and parcel of what you offer to your patients in the future. Now, virtual reality and augmented reality has been there since the 1960s. It's nothing new. This is not something which has come in the last 10 years. It has changed though, because this is what it used to be like. And when you were kids, I don't know how many of you were from the villages, but there used to be this mobile cinema guy who used to come around and used to kind of watch the videos of it, by paying him about 5 rupees or something. So it's been there from before, and it's just developed into these robots and so forth at the moment. Currently, we're using not augmented reality, but AI-based technology. So CUSA, so Cavitron ultrasonic aspirators, ultrasound intraoperatively, 4-dimensional or 3-dimensional 4K laparoscopic systems, surgical systems. Now we're getting four-dimensional instruments coming through as well. And the computer helps us assess how much liver you can take out for a patient, so something called volumetry. So these things are still in place, which we utilize to make surgery safer, better for our patients. Now, you might have come across this in your medical school early days when you were doing anatomy. Now, I remember back in 2002, this used to be a very rudimentary form of anatomy and used to kind of move the liver around, and if you look at various organs and so forth. Not as good as this now, but it's a bit better. But back then it had poor pixels, but it was there. So this is a form of artificial intelligence, augmented reality, and it is there in your practice. So this is nothing new that we're talking about. Again, the question, should you be investing in robots and augmented reality if you have these problems to deal with? Like I said, different strata will require different treatment, different strata will require different utensils. We have got all these problems in our healthcare system, which we have to adapt to. In Peshawar, that's where I work. This is our catchment area, so all of Afghanistan, KPK, and a bit of the northern areas. 5% of incidence of liver cancer and pancreatic cancer, so that's a huge volume. So that essentially means almost 500 patients per month per year in KPK get some sort of liver or pancreatic cancer. So that's a huge number. AI can help you assess the needs of the patient, the needs of the system, the needs of the organization, and you can help decide on better management of resources. But I'm going to talk about augmented reality only, not the AI part. So augmented reality can be of different types. You can have an overlay. So essentially what an overlay is, you have the human body in front of you, but you superimpose an image on top of that. You can have mixed reality where there is a merging of the real world and the artificial world, or you can have virtual reality in which you're completely immersed in that digital environment. So three different forms. And again, mostly we are in this part at the moment, and hopefully in the future we might be headed to that part. Currently, this is from the United States. This is some form of augmented reality happening. So this is an intraoperative ultrasound being performed for a cholecystectomy patient, and you can see the gallbladder. And I don't know if you can see it clearly with the light, but you can see the impression of a stone in the Hartmann's pouch. And this is an ultrasound scan showing you what you're about to do and so forth. So in other forms, um, this is the robot. It has an overlay of a tumor, and it is telling you where the structures are compared to where the tumor is. So now the problem with this is the picture is static, the liver is moving. So that's where the problem arises at the moment. Your picture is not moving with your organ. So you don't really know how the relationship with the vascular structures is going to be once you change position and so forth. But it does give you an idea of where things are and so forth, and it helps you kind of avoid getting into trouble. So that's one form of augmented reality that's still in place at the moment. Image based, so we're doing laparoscopy. Laparoscopy is essentially a form of image, computer generated imagery, but we need to go from 2D, in which you are looking at a two-dimensional image and your brain is doing all the work for you, converting the 2D image into a 3D image. And if this video runs, they always say don't put videos in your presentation, but I never learned. You want to convert that into a 3D image, which helps you decide where the organs are. So this is in use. This is from IRCAD, so that's in, I think, in France. And they essentially, you can see the tumor there. This is the vascular structure, and you can see that vessel going close to the tumor. And as the surgeon, the thing that you worry about in liver surgery is bleeding from these structures, because they bleed a lot, because they're high volume, low pressure system, and once you get bleeding, it's very difficult to see where it's coming from. So this gives you an idea where things are, and you can be a bit more careful in that area. Now, it's a continuum. So when we talk about virtual reality or augmented reality, it's a continuum. At one end of the spectrum is your real environment. So we are in a real environment right now. And the other end is the virtual environment. And in between, you've got augmented virtuality, augmented reality, and so forth. Now, when we talk to all the virtual reality companies, this is what they sell you, right? So this is your McDonald's burger in your advertisement, and when you see the advertisement, the next thing you want to do is get in your car, go to McDonald's, buy that burger. But when you buy that burger, this is what you get, right? So not everything that is being sold to you is what is being projected. So next here. So the first thing that we got now in terms of where we are is the projection of the system. So this is fairly common, and I've shown you a few examples of this earlier, where the ultrasound was projected an image of the stone. And this is a video, if it works. Does it work? Does it work? Let's see if it works. Yes, I think it works. Here we go. Start from there. Right. Anyway, I should have learned my lesson. Don't put videos in your presentations. Anyway, so here we go. So here is a video of, thank you for that. So here's a video of a laparoscopic cholecystectomy being done, and this is ICG essentially, but it is a form of augmented reality where you inject a dye into the system, and it tells you and it highlights where the structures are for you. Now, this is very helpful because now you know where you are and what damage you're about to cause if you're in the wrong place. So the same thing, maybe press something. So now taking that thing forward, you take the same imaging and you convert that into a robotic system, and at the bottom you can see the tumor is being projected onto where the liver is. Now this is in use now. So this is 2013, so a bit outdated technology now. But the problem with this was that the tumor is staying in one place. But in reality, when you're doing surgery in a 3D environment, and the relationship of the structures that you come across keeps changing. So for a good system, augmented reality system, you need high quality images and you need changing real-time information. And if you have these two available to you, your surgical accuracy increases, the collateral damage that you can cause during surgery reduces, as does the complications. So the problem is, we've got this high quality images, we've got 4K, we've got 3K, we've got HD and so forth. This is the problem. The real-time transformation of the data to the computer, so that the computer knows what angle you're looking at and where that structure is going to be. And you have real-time information. So here we go. So this is a few personal. So there's a few images of where we are right now. So this is a virtual model which helps you in pre-op stimulation. And this is all from IRCAD, so it's all there. I'm not making this up. And these kind of images take a CT image or an MRI image, and it converts it into a model for you, which you can use for your pre-operative planning. Now, you can use this to decide where to put your ports when you're putting your surgery, because you don't know where the liver is going to be or where the tumor is going to be in relation to where you're putting your ports. You can use it to take a biopsy. This is, you can see the tumor starts getting bigger as the lesion starts going in, and here you go. You can see this, the tumor. You can see where things are, and this is, by doing this, you can actually practice the operation before you actually go into the operation. And these are some of the stuff that we have got at the moment. Now, this is mostly with the robot. We don't have this stuff in laparoscopy yet, because laparoscopy uses a different system. The robot is essentially an AI generated program machine which kind of takes the data in real life and converts it for you. And we're going to move on. But this is what we should be aiming for. So here you take a 3D generated image, and then you take an image of the video and you superimpose it on each other in such a way that when you change the direction or the positioning of the camera, the system automatically adjusts the image that they projected onto the organ according to the view you're getting. So what that does then essentially is, it gives you a much better understanding, the spatial understanding of where you are and so forth. So here you go. This is if you've seen this video, this is the area, this is where the vessels are coming up. Now, the problem with this is, you can't see your instruments now. So the computer has to find a way to subtract that instrument out of the view so that you can see where you're going. And this is happening at the moment as we speak, and this is a lot of work going on into this. It's still not there yet, because the problem, like I said, is you move the liver up and down, the picture doesn't move according or along with it. So we need to find a way to get over this. Right. So this is where deformation-based augmented reality comes in. So the name says it all, deformation-based augmented reality. So it deforms the picture for you to give you the view that you need to see. And hopefully this video will run. And as you can see, it tracks the images. Now look at that. So there's a tumor here. These are the vessels. And as you come in, and this is a laparoscopy being done. This is not robotics. And there's robotics in that one, but this is laparoscopy. So as you lift the liver up, look at the stretching of the organs and the vessels. So that's essentially changing things. And here is the thing that is going to be in the future. This is called elastic registration and augmentation. So you put small beads in the liver or around the liver, and then the computer tracks those beads accordingly. And this is very basic at the moment, but this is going to develop with time. And as you move the liver around, the vessels, the structures, the orientation, that keeps changing with the video as we go along. So as you can see here. But this is, and then as you split, you can see here. So this is all the beads placed. This is a kidney, and as you split, it tells you what you're splitting, the vessels that you're about to split and so forth. So it gives you a very deep understanding of the spatial area that you are in, and then the structures you're about to encounter. So this is going to be very exciting stuff for liver surgeons when it comes. I don't know when it's going to come, but whenever it does. But it's not just for laparoscopy. Now here is a video of open surgery being performed, and this is still in experimental stages. But the surgeon is moving the liver around, and look at what is happening to the structures. And this is showing you the inside of the liver without cutting the liver. Now, for a liver surgeon, that is just like a gold mine. If you have this, liver surgery is going to be very easy, because now I know what I'm about to cut. So anybody can do this surgery. Right now, we work with the unknown. We don't know what you're about to cut in. You have an idea. We don't know the next cut that you're going to put is going to cause bleeding. Is it not going to cause bleeding? Is it going to cause bile leak? It's not going to cause bile leak. But with this, I mean, I know exactly what I'm about to encounter. So it's just going to make my life easy. But luckily, it's not going to come in my lifetime, so I'm not going to be out of a job. You guys might be out of a job because a lot of people will be doing liver surgery. But here is the problem. This is the kind of equipment you need at the moment to help with this. Now, there's already enough screens in the OR. You've got your 4K CDs, you've got your temperature control scans, you've got some other stuff going on, you've got your screens going on. So it just becomes too cluttered. So there has to be a solution for this, and I hope this changes. Here we go. So a, this is the setup that we have no, we don't have, but some of the big centers like Ircard have at the moment, where there's just screens after screens after screens. But here we go. This is where we think this is going to go. You put on the HoloLens. I'm sure somebody's heard this already. So you got your Apple View, Apple World, and I don't know what else technology there is. But the HoloLens. So here's the surgeon using the HoloLens. It's projecting the CT images and the MRI images in front of you in a holographic manner, and you can manipulate the structures. You can manipulate the organs accordingly, see where it fits in without actually doing anything before you start the surgery. So you can, for orthopedics, for kidney transplants, for liver surgeries, and this is going to be something which is going to be very, very, very helpful when it comes. I don't know when it's going to come, but whenever it does, it's going to be very helpful. So evidence for AI in surgery, very few centers across the world doing this, right? And they are the ones with big money, with big budgets. So they've got like millions and billions available to them to make this work. But the data is coming through slowly and surely. The gadgets are coming through. Very few limited randomized trials. Um, I would say we are in the very, very early adoption phase of this technology, just like laparoscopy in the 40s and the 50s. Very few people were thinking about it, taking them on, and there was a lot of naysayers about it. But we are right now after 30, 40 years. Probably the same thing is going to happen with this. Eventually, the precision is going to improve, because right now it's not precise enough. I won't do surgery with any of these instruments at this moment in time, but the stability has to improve, the synchronization has to be better, so when I move, the organ moves accordingly and accurately. The deformation has to get better, the cost has to come down, but eventually all of this will happen in 20, 30 years. Like I said, by the time you guys are 40, this is going to be reality, and we're in a very early adoption phase of this. We don't have to take it on, but we can't ignore it. We have to know what's happening in this world. We know where it needs to develop, and along with looking for new technology, we need to develop our workforce. So this is our team which is developing. So OR staff and your colleagues are always going to be there, because even with augmented reality being at the best stage of its development, you're still going to make mistakes. You're still going to cause problems with the bleeding. You're still going to get into trouble, and you're still going to need your colleagues to come in the middle of the night and help you out, get out of trouble. So don't forget about your colleagues, even if you're going into augmented reality. Thank you so very much.